My name is Casey Calkins. I'm an associate professor of pediatric general and thoracic surgery here at the Children's Hospital of Wisconsin. I picked being a doctor as a career because I volunteered in a hospital when I was in high school. And initially, I wanted to be an architect because I like designing things, but for some reason, taking care of patients really appealed to me. And so I went to college with that intent, and then just kept on seeing it through. And I love taking care of people. It really brings a lot of joy to my day. Probably the highlight of my day is seeing patients return to whatever it is they were doing beforehand, return to school, return to their lives, return to their families, coming back to clinic after we've done surgery and them realize a complete recovery. That makes me feel wonderful. So that's definitely the highlight of my day. I have several different hats from a surgical standpoint. My one area of interest is the correction of congenital defects of the colon and rectum in children, and I work with our gastroenterologists in a specialty clinic in that regard. I do a lot of thoracic surgery, so lesions of the lung, congenital lesions of the lung with minimally invasive approaches. So I do a lot of operations through little incisions, and I was trained to do that, and I brought that skill here when I finished. And then the third thing is I'm involved in our fetal treatment center. So those are patients that we see in conjunction with our maternal fetal medicine colleagues over at Fredert. We have a multidisciplinary approach to those patients, and we've done operations on fetuses in the womb and or fetuses that are about to be delivered. And so that's another area of expertise that I bring to the table in our group.